Which assessment finding is most concerning for potential AAA or abdominal aortic aneurysm rupture?
C.
C, sudden severe back pain radiating to the abdomen. I'll post it. Y'all are too good about looking ahead if I post it beforehand, so. Priority nursing goal for an aortic dissection management is what?
B.
B, maintaining systolic blood pressure 100 to 120. Good, like it. Okay. Saccular aneurysm is described as what?
B.
Outpouching only at a distinct portion. Okay, good. Saccular aneurysm. Remember, it's creating a sac off of that main artery. So with your falciform aneurysm, which is this may be the next question, I can't remember. So the falciform is the full circumference of the artery. The entire artery or vessel is involved within that. Okay. Saccular is just kind of off of the one side or another. So it just kind of creates this bowl effect. All right. Nope, next question, where we're at. Which population receives AAA one-time ultrasound screening? We hit this pretty heavy, right? D, good. Men 65 to 75 who have ever smoked. Now, it's also selective too. If they've never smoked, but the physician thinks it's in their best interest, or they've had some type of strong genetic component, then I can also think about an ultrasound screening for them as well, okay? Neurogenic shock after a spinal injury presents as what?
D. B.
Hearing B, heard a D in there too somewhere. Not a D in there. Who? Everybody agree with B?
I say B. Yeah.
So we got, I like B. Hypertension, bradycardia, and warm flesh skin. Okay. Autonomic dysreflexia is caused by what?
C.
C.
Good. Some type of noxious stimuli. Give me some examples of noxious stimuli.
Tight clothing.
What'd you say?
Tight clothing.
Tight clothing, okay.
Urinary retention.
Urinary retention.
And ileus.
Ileus, fecal impaction,
Fecal impaction.
pressure points, good.
Temperature sensitivity. Anything.
Anything really, yeah.
Pain.
First action for suspected autonomic dysreflexia. Someone said A already. Everybody agree with A?
Mm.
What if I don't agree with A?
You're wrong.
Okay.
Can you put that on the text?
Can I put this on that I'm wrong?
No, that question.
We'll get out for sure.
Which bleed has a lucid interval?
B.
I hear B. Everybody agree with Natalie?
Mhm.
She's not licensed yet, but do you agree with it? That wouldn't have did get you, you're just
I
not
think it
licensed.
was.
Compared to others, so, you know.
Okay.
I'll be checking, when y'all take that NCLEX, I will, be looking. So most sensitive early neuro change indicator,
LOC.
LOC. I hit that one a lot, right?
Yes.
Okay.
We should get that one
Mannitol administration, main nursing priority.
right. D.
E, use a filter, monitor that urine output, make sure my urine output is nice and steady. So remember, I'm trying to diurese out that extra fluid and maintain my electrolytes.
They have to stay warm still.
What now?
Does mannitol have to stay warm still?
I don't think it does, not anymore. I haven't given mannitol in a long time. I think it's, could be a room gel now, just regular.
Cause you know at one point it had to stay warm.
Yeah. Last time I gave it was like 7 years ago, so
Oh,
it's been a long time.
you're
But
a baby nurse.
I was a baby nurse. And basically all they said was give mannitol, send to Birmingham, so that's what we did.
Okay.
Patient diagnostic imaging reveals a diffuse dilation affecting the entire circumference of the abdominal aorta.
A.
Type of aneurysm best described. Alright, so now we have the fusiform. Alright? So now it's the entire circumference. The entire thing that's involved. It's an ugly looking image, but fusiform, good. Patient arrives to the emergency department describing a sudden, severe tearing and ripping pain in their back that is moving towards their abdomen. These symptoms are most characteristic of which vascular emergency?
B.
Here, B. Anybody else? Everybody like D? I like D. Aortic dissection. Tearing, ripping type of pain in the back. Remember, it moves from the original point of origin, okay? It can be very hard to distinguish between thoracic aortic aneurysm and aortic dissection. Imaging is going to be your best friend with that.
Could you see Cullen sign on the thoracic or Graves tunnel?
Explain that as not
The
much of it is,
bruising, the bruising.
Oh, yes, yes,
The bruising.
yeah, exactly. Bruising.
D.
High level spinal cord injury, suddenly develops a pounding headache, profuse sweating on their face and neck, blood pressure of 210 over 120. What is the nurse's first priority action? You said raise the head of the bed. All right, so what are we thinking this patient's undergoing?
Auto dyslexia.
Dyslexia, that's where you confuse your words.
Oh,
The last
dyslexia.
answer that was the
Autonomic dysreflexia?
yeah.
Okay, good.
Raise the head of the bed, then you can give some norepinephrine or no.
Yep, so raise the head of the bed, then I can move over, because this one's already ordered, administered an IV beta blocker, okay? Then I can potentially check for an fecal impaction, and then I can notify my provider at the end that I did all this stuff. Right? Okay. Pounding headache, above the level of their injury. That diaphoresis, that profuse sweating. But remember, the biggest thing, severely high, sudden rise, sudden increase of your blood pressure. 210 over 120, that's kind of high, right? Right. Football player is injured by a direct blow to the head, causing sudden acceleration and deceleration. This mechanism is an example of which type of spinal cord injury? This is the one that Nellie couldn't do, remember? C. Hyperextension. Can't do both at the same time, right? Okay.
I was doing
Hyperextension.
both at the same time, I'm pretty sure.
Okay. A patient with a traumatic brain injury briefly lost consciousness at the scene, was then alert for about an hour, and is now rapidly deteriorating. This presentation with a lucid interval is a hallmark sign of which condition?
C.
C, epidural hematoma. Good. A patient with a traumatic brain injury briefly, already said that. All right, there we go. Keep going. Which of the following vital sign changes make up Cushing's triad, a late indicator of increased intracranial pressure?
D.
D, severe hypertension, good, widened pulse pressure, and bradycardia. What is the body's first compensatory mechanism to manage rising ICP?
A.
Everybody agree with A?
I know it's not me, that's the last one.
Right. D is the last one, right? That's death, right? D is death.
A or C is.
All right. Displacement of CSF. Remember, it's going into that subarachnoid space. They might have that sniffly, congested type nose. They may report that stuffy type nose as well. And then eventually, we're going to have decreased cerebral blood volume. And then the last one, like Sam said, that downward herniation of that brain tissue. Once we get to that point, it's pretty much over at that point. Okay? Patient receiving IV infusion of mannitol, and this one kind of hints off the other one too, but To treat cerebral edema, which nursing action is essential for the safe administration of this drug?
E.
Good. Using a filter with IV administration set. 70-year-old male, history of smoking, undergoing a one-time ultrasound screening. According to the guidelines presented, what condition is this screening primarily intended to detect?
A.
D.
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 Everybody but Natalie says it, D. You got D?
I'll change the D.
Change D,
Never
okay.
mind.
D, abdominal aortic aneurysm. Good. A few more. Patient with a traumatic brain injury has a Glasgow coma score of 7. Has been unconscious for over 8 hours. How would this TBI be classified?
C.
C, severe. Good. Good, good, good. All right, thanks for playing.
You're welcome. I don't think we got much of a choice.
Not really. All right, I will post that as part of your emergency stuff. Are y'all okay with navigating just the emergency page, or do I need to split it up in different
No, I
pages?
like it on one.
You like it all in one? That wasn't a big on you, I'm just making sure. It's gonna get crowded pretty quick, but you only have one more lecture, so. Okay. Review this. If you have any questions, please let me know. If you didn't get signed up for your HESI, I think all y'all should have though, sign up for that. Don't show up to class next week, because that is Veterans Day. All right, I won't be here, I'll be in the woods, but you can sit here if you want to. Strictly up to you, okay? Y'all have a great night, great evening. Everybody sign the roll.